The Florida Senate recently approved an $800 million plan to increase access to medical care. The Live Healthy Act would include tuition assistance for medical, nursing, and dental students. It would also include loans to build clinics and create a statewide health screening portal. The measure still must be approved by the House before heading to the governor's desk. Dr. Christine Caulfield, the CEO of LSF Health Systems, is joining us this morning. Good morning. Thanks for being with us. We appreciate it.
My pleasure.
So if this bill is approved, would you explain the impact it will have specifically on behavioral health services?
Absolutely. Well, first of all, I'm delighted that it passed through the Senate, and I really am hopeful that it will pass through the House as well. And basically what this addresses, this bill, is workforce shortage, and we're in a huge crisis right now, particularly with behavioral health professionals. So this bill offers a lot of incentives to bring clinicians from other states to be able to practice here by reducing and eliminating the barriers to that licensing reciprocal agreements. So great news for behavioral health.
So it's interesting too, because there's a shortage, but there's also an increased need in behavioral health, and that really kind of kicked in as we saw during the pandemic.
Most
you
definitely.
kind of explain that just spike in need for services that particularly mental health, professionals kind of experience in the last 3 or 4 years?
Oh yes, it's been devastating actually, and we're still feeling the ripple effects, frankly. We see suicide rates increasing for young people particularly. There's all sorts of continued issues. So that is why this bill is so crucial for our state. We need this to pass because we need to address the workforce shortage, particularly for behavioral health care professionals.
Well, and now we're talking about just even what you've seen, let's say in Northeast Florida, but there's some rural areas that have really been hit by this as well in terms of the need there that just isn't being filled.
Absolutely, and this bill also addresses the rural deficits in professionals. So one thing that the bill does is incentivize healthcare professionals to work in rural communities, help them want to remain in Florida after they graduate, and then incentivize them to practice in rural areas with loan forgiveness. There's all sorts of very good incentives here with this bill.
So some state legislators have been critical, certainly, of the legislation because it doesn't accept an expansion of Medicaid, that it would essentially give the state billions of dollars. Is that a fair criticism of this?
You know, you can't please everyone with
Right, all the time,
legislation.
sure.
Exactly. But one thing it does do to address the poverty folks that are living in poverty is it increases the percentage rate of those from 200% below poverty to 300% below poverty line, really opening up more services, free clinics for those individuals that live with poverty.
So it's interesting because this as we're hearing this bill is filled with all sorts of caveats there that can really help specific individuals and services and anybody who wants to get into this business. Are there any other benefits for Floridians that's in this that we may not be aware of?
Actually, there's going to be a lot of money going to teaching hospitals, really incentivizing professionals that want to enter the behavioral health care field, loan forgiveness package in this bill as well. So I really encourage viewers to keep abreast of this bill. I think it's going to pass unanimously through the House as it did in the Senate, and I think it's great news for Floridians, particularly those that live with mental health or substance use disorders. We're going to see the workforce increase to be able to meet the gaps in service delivery right now.
All right, so we will be tracking. It's the Live Healthy Act. Thank you, Dr. Caulfield, for being here and explaining what's in this and the impact that will have for our viewers and also when it comes to mental health services as well available in our area.